Dr. Sharfstein, I'll cut to the chase. Everyone's looking at the United Kingdom, and Lisbon and Portugal seem to be the worst right now on India Delta. Let's start with a why. Why are pros like you looking to the United Kingdom?
Well, because the United Kingdom is pretty highly vaccinated, but is also now seeing an increase in infections, and overwhelmingly these infections are the Delta variant. So this is sort of the next chapter of the COVID pandemic, and just reminds us that for every move that humans make, the virus has another one, and we just have to continue to press the case against the pandemic.
Dr. Sharfstein, how is the Delta variant different from all other variants? The idea here being if you're vaccinated, you're still highly protected against it, right?
Well, you really need both shots to be protected. One shot really doesn't do that much for the mRNA vaccines. That's one difference. But in general, vaccination is the best protection against the Delta variant. It's just that there are still a lot of people who aren't vaccinated, may have decided to wait it out. And that is not a good decision given the transmissibility and the lethality of this particular type of virus.
There is a concern, especially with the prevalence of only one-shot vaccinated individuals in the United Kingdom, of not necessarily Delta, but Theta, Eta, Epsilon. The idea here of all of the additional pile-on variations that could spring up. Are we seeing evidence of any further mutations?
Well, the virus is constantly mutating, so I'm sure there is evidence of that in countries around the world. And as long as that virus has billions of chances to replicate every second, really, then new variants can come up. There constantly are variations in the virus, and the question is which ones make it more transmissible and more lethal. So we're fighting against an enemy that is constantly changing. The best thing we can do is give it fewer and fewer opportunities to do that.
Fewer people are dying, that's for sure. Do you start to think we need to shift what we're counting in terms of counting infections, counting deaths, counting hospitalizations?
Well, those are the big three. And I think, the number of overall cases is a bit of the leading indicator for hospitalizations and deaths. And fortunately, as there are fewer people, people can get more intensive care. There are different treatments and hopefully more treatments coming. But our goal should be to prevent, as many infections, hospitalizations, and deaths as we can. But we should be looking at all three, I think.
When you look at a map, Doc, of the U.S., are there places you think that are vulnerable to a UK-type resurgence? Because surely we've got the coasts vaccinated, but the middle may be a problem.
Well, I was just in the American South, and there's not a lot of mask wearing, but I also know that those states have relatively low vaccination rates. So that combination of low mask wearing, low vaccination rates, and people thinking the pandemic is over or was overblown or something like that, that's a dangerous combination. And we know that the Delta variant is going to be spreading there pretty soon.
Dr. Sharfstein, late in the Padres game yesterday against the Cincinnati Reds, Myers of San Diego hit a ball down 4 feet inside the foul pole. He went to third base, there was a throwing error, and then he ran home with what's called a Little League home run. The roar of the crowd shocked me. That's how much we've been affected by this pandemic. Would you sit in that crowd?
Outside, I would probably sit in a crowd like that. I think that, I'm vaccinated, and vaccines are very effective, and the virus doesn't transmit that much outside. But, people who aren't vaccinated, aren't wearing masks, or inside at the concession stands, they could pick up COVID, particularly the Delta variant. So I don't think that's such a safe environment necessarily for everyone, the bathrooms, other places, in the ballpark. So, it's just that we're not there at the point where we can stop thinking about the COVID pandemic. We should be, the end game. This is like the end of the game. We need the closer to come out, to take your baseball analogy, and pitch some strong innings at the end in order for us to really move past that. And that means really talking to people in your life, helping them get vaccinated. That's really, really important for us to put this in the W column.